Welcome to this presentation on myasthenia gravis. Myasthenia gravis is a chronic autoimmune neuromuscular disease that can affect any voluntary muscle in the body. The immune system creates antibodies against the acetylcholine receptors on the muscles, interrupting message transmission to the muscles to contract. Often a progressive disease, myasthenia gravis causes muscle weakness that gets worse with activity. The main symptoms of myasthenia gravis are muscle weakness and fatigue. Oftentimes, the first signs of myasthenia gravis are problems with the eyes. This would include drooping eyelids, also known as ptosis, and double vision, also known as diplopia. It may also first present itself with difficulties swallowing and slurred speech. In about 15% of patients, the disease remains ocular. However, as stated before, it is most often a progressive disease that ends up affecting the entire body. Here we have an image of an example of ptosis, which is the drooping eyelids. This can either affect one or both eyelids. The main cause of myasthenia gravis is the interruption of the transmission of nerve impulses to the muscles. The body creates antibodies to block, change, or destroy the muscle's receptor sites for acetylcholine, which is a protein that is required for muscle contraction. Because of the damaged acetylcholine receptors, the muscles receive fewer signals which cause them to become weak. While most cases of myasthenia gravis are caused by acetylcholine disruption, it may also be caused by the body having antibodies to muscle-specific tyrosine kinase, which is a protein that assists in the formation of the neuromuscular junction. It is also important to note that scientists do not believe that myasthenia gravis is a genetic or contagious disease. Scientists also believe that myasthenia gravis has something to do with the thymus gland because it plays a major role in the development of the immune system. This connection, however, is unclear at this time. In some cases of myasthenia gravis, patients have an enlarged thymus gland, a thymoma, which is a tumor on the thymus gland, or overactive thymic cells. Here we have an illustration. On the left we see a healthy neuromuscular junction. On the right we see the neuromuscular junction in a person with myasthenia gravis. As you can see, there are antibodies attacking the acetylcholine receptors on the muscle cell, which is interrupting the acetylcholine connection. There are many treatment options available for myasthenia gravis, depending on the patient. Corticosteroids and other immunosuppressant drugs are utilized in myasthenia gravis treatment because they suppress the production of the abnormal antibodies. Cholinesterase inhibitors block acetylcholinesterase, thereby increasing the acetylcholine in the neuromuscular junction, which allows the muscles to get the messages to contract. Other treatment options include therapies such as plasmapheresis and intravenous immunoglobulin. Plasmapheresis is similar to dialysis and removes the antibodies that attack the acetylcholine receptors. Intravenous immunoglobulin puts normal antibodies back into your body. Also, some patients may receive a thymectomy, which is surgical removal of the thymus gland. Not all of these treatments will work for every patient, and results are varied. Also, there is no current way to prevent myasthenia gravis. Serious complications may arise from the disease and also from some of the treatments that are used. One such complication is called myasthenic crisis, which occurs when the muscles that control breathing have become too weak to work properly. Other complications that may arise would be kidney damage, liver damage, and increased susceptibility to infection from use of immunosuppressant treatment. There is some knowledge about myasthenia gravis, yet still much left to learn. We do know that myasthenia gravis is an autoimmune disease that affects the acetylcholine receptors on the surface of muscle cells, which interrupt the messages that are sent to the muscles to contract. While if treated correctly, a person with myasthenia gravis may lead a nearly normal life, complications may arise from the disease, especially if it is untreated or not properly managed. For more information, please see the following references. This concludes this presentation on myasthenia gravis.